Thank you for joining us today to discuss the prior authorization function within the Secure Portal. My name is Karen Curtis, and I will be your presenter today. Joining me is my good friend and coworker, Aline Sigler. I also have my friend Mary Sue Gardner on the line. Aline's going to be helping me out today by watching the chat for any questions that you may have and also adding additional information when needed. Today I hope to increase your knowledge on how to submit prior authorization requests within the portal, how to search for those requests that have been submitted, and looking at exemption letters. You will see at the bottom here that there is some legal disclaimers at the end of the presentation. That just lets you know that CMS does prohibit recording of these webinars, and their website should be checked for any additional information. Now, in order to perform these functions, you will need to be a registered portal user. So I want to briefly cover that process before we get too far into the presentation. When you visit the WPS homepage, there's going to be a large box with our logo and the portal login box that you see here. Now, if you click on other pages, that logo will disappear, but the login box is going to remain. And under the user ID field, you're going to see a link to register. You will be asked to accept the terms for use for the transactional area and the general area. A transactional area refers to specific actions that take place within the portal, such as data transmissions or user interaction. And the general area is broader, and it refers to things such as data privacy policies or copyright information. So after accepting those terms, you're going to be moved to a provider access page, which is shown here on the left. Here, you will enter your NPI, PTAN, and tax identification number. If you are part of a provider group or clinic, then you must enter the group number and PTAN. You will not be able to register using the individual provider's information. When you self-register, a request is going to be sent to the NPI administrators for your facility or office, and they're going to need to approve or deny access. So this means you're not going to be able to log in until your request has been approved. But you can also have your NPI administrator create an account for you, which would eliminate that approval process. Now, there's also the possibility that you're going to receive a message about registering as an NPI administrator, which is shown here on the right. This occurs if the NPI entered has fewer than 5 administrators. So if you don't get this message, there's no reason to be concerned. Nothing is wrong. It just means that you already have at least 5 individuals as in the NPI administrator role. So if you aren't the appropriate person to take on this role, you're simply going to click no, and you're going to continue with the registration process. Now, if you accept the role of an NPI administrator, there is certain financial information that must be provided. So you must have access to patient, payment, or claim information that would appear on a remittance advice issued within the last 30 days. Now, within the portal, there are 3 different access levels. There's eligibility, shared users, and NPI administrators. Eligibility users have access to verify patient eligibility and contact customer service. So the prior authorization function would not be available at this level of access. Now, the picture shown here is of a standard user's homepage. The NPI administrator homepage looks similar, except they have an extra function that's titled Users, which appears on the practice card between the My Profile and Customer Service options. The prior authorization options that we're going to be talking about today are the first 2 functions located on the transaction card. Now we're going to start out with submitting a request. To access this function, you're going to click on the plus sign that is next to the prior authorizations button. This action is going to open up the new request form, and the first thing that you're going to need to do is select your MPI from the drop-down box. Now, if the supplier or the facility's MPI doesn't appear in that drop-down list, then you're going to need to request access to the MPI before you could submit your prior authorization request. Now, to request access, you're going to need to choose the My Profile function where you find an option to request MPI access. After choosing the correct MPI, you're going to choose the service for which you are requesting prior authorization. The drop-down box will list the outpatient hospital services. Submit to prior authorization. Now, while we're taking a look at these services, here on this list, I would like to talk about some inquiries that are coming into our customer service department. In 2026, CMS is launching a prior authorization demonstration for certain ambulatory surgical center services. Now, this demonstration is only applicable to certain states, and it does not include Nebraska, Iowa, Missouri, Kansas, Michigan, or Indiana. I will have add a link in the chat in case someone would like more information on that. We can pop out here real quick. This is the website that I had her at in the chat. So it is for the ambulatory surgical center services, but it does list here, these are the providers it applies to, so it's nobody within our jurisdiction. So I just wanted to clarify that. Now, after the service is selected, you will select the appropriate radio button to indicate whether the request needs to be expedited or not. Expedited requests should only be used when the standard time frame for making decisions could seriously jeopardize the patient's life or health. Now, the next section of the form is going to be the facility information. So these fields should be auto-populated based on the MPI that was selected at the beginning of the form. Information for the beneficiary receiving the services is going to include the first and last name, the Medicare number, the date of birth, and the sex. Now, as you move down the form, you're going to find the next section, which is requester information. The majority of the fields should auto-populate, but you will need to add your title. Next is the physician information. You will need to have the information for the physician who is performing the service, the first and last name, the physician's MPI and PTAN, as well as their address. You'll see fax numbers are optional, but it could be helpful if things need to be sent back and forth. The additional information section is where you're going to add details about the procedure that's going to be performed. So here you're going to provide the anticipated date of the service and the type of bill. If the request is approved, the prior authorization is valid for 120 days. If the actual date of service is different from the anticipated date of service, a new request does not need to be submitted as long as the procedure is performed within 120 days of the decision. There will be a drop-down box where you're going to select the applicable HCPC or CPT code. The codes shown will correlate to the service that you entered in the preliminary information section. There had been some issues with the CPT code that the user selected didn't match what was submitted, but I have been told that that was corrected on December 8th. So if you've had issues with that in the past, then hopefully you won't have any more. Now below the HCPC and CPT field, there's going to be a field where modifiers can be entered if they apply. You will need to enter a number in the units field, and if there's any pertinent information that can be entered in the additional information field. At the bottom of the screen, you can see a button that reads Add Row. So if the provider is going to be performing more than one procedure that requires prior authorization, or if the provider may change the procedure like intraoperatively, choosing Add Row will allow you to enter information about the additional procedure. If there is a question as to the exact procedure that may be performed, it would be best to submit a request with several potential service codes, and that way you can avoid a denial due to no prior authorization. So here's an example of what it would look like if you add a row. A new additional line box will open with all of the same fields. You'll enter the anticipated data service, the type of bills already populated, and you will choose an additional procedure from the drop-down box. You can add modifiers if applicable, enter the number of units, and any additional information. You will notice there are also options to delete a row if necessary. The next section of the form is for uploading your documentation. There are some notices listed. File names can't be more than 100 characters. Accepted file types are listed after that. The file size cannot exceed 100 megabytes. We also cannot accept attachments that are password protected, contain macros, or external links. So please disable any settings of this type before attaching. If you do need to attach multiple files, you must submit them in a single zip file containing no more than 30 individual files. WPS does have a resource on our website that's going to help you determine what type of documentation should be included. I will have add a link in the chat, but if we go out here, it does go through, excuse me, the list of services. So it will list the codes that are applicable for that service, and then it has providers should include the following documentation. So it does give you examples. It gives you links to the LCDs, to the manual chapters, things like that. So it is really a good resource to find additional information on the services that you're requesting that prior authorization for. Now you're then going to be asked to provide an electronic signature by marking I agree. If you do not accept, then you will not be able to submit the prior authorization request through the portal. After selecting I agree, then you're going to review the information that you've entered. So to review the information, you're just going to click on those down arrows that you see on the right side of each section. If there's any errors that are found, then there will be an option to edit so corrections can be made. If all the information is correct, then you can choose to submit. Our users will receive notification of a successful submission along with a confirmation number. Options that you see here in the upper right-hand corner are to print the confirmation message, to start another prior authorization request, or if you select done, it's going to return you to your home page. Now, some providers may have the option to submit prior authorization for repetitive scheduled non-emergent ambulance transport, or RSNAT. This service is for routine, medically necessary ambulance trip for services such as dialysis or wound care. While most of the form is the same as with the other prior authorization requests, there are some differences, so I thought it was worth covering. Now for RSNAT, you're going to enter facility information. You're going to enter supplier information instead of facility information. Much of the information is the same. You'll include the supplier's name as well as their address. Down at the bottom of this section, you're going to see a field where you're going to enter the state where the ambulance is garaged. Now for beneficiary information, you're going to enter the name, Medicare number, and date of birth of the patient that's being transported. Next, we have the requester information. So this includes the name, phone number, and email address for the individual requesting the prior authorization. You're also going to have to enter information for the certifying physician. This is going to include their name, MPI, and PTAN, as well as their address. CMS allows MACs to affirm up to 40 round trips or 80 one-way trips per prior authorization request within a 60-day period. So in the additional information section, you're going to want to enter the number of transports that you are requesting prior authorization for and when you want the 60-day period to start. There's also fields to enter the HCPC and then any applicable modifiers. Now, there's the same documentation rules as with other requests. We also have a resource on the WPS website that provides some guidance. I'm going to have Aline add that into the chat, but we'll also take a look at that. So this is going to be specific for the RSNAT services. There is some information here on the prior authorization program parameters, documentation guidance, requests and documentation submission. So here's another really helpful resource that can help you when you're wondering what you need to send along with this prior authorization request. Again, you're going to be asked to provide electronic signature by selecting the I agree option of the electronic signature. You'll review any information that is entered by clicking on those drop-down arrows on the right-hand side. Again, if any errors are found, you can choose the edit option and so that corrections can be made. But if all the information is correct, then you can just choose submit. And then just like the other prior authorization request, you're going to get that successfully submitted notification, excuse me, with the confirmation number. And then again, you can print it, you can start another request, or you can go back to your home page. Give me one moment here. Okay, sorry about that. Searching requests. So you want to take a look at something that you've already submitted. You want to see where it is. Is it pending? What's going on with it? So that's the next part we're going to look at is how to search for the requests that you've submitted. So you're going to click on the larger prior authorization button, and that's going to take you to the searching page. So here's what the screen's going to look like when it opens up. It's going to have all of the prior authorization requests that have been submitted under the NPIs that you have access to. So results can be narrowed down by entering information in the fields at the top of the screen. So there's also a box to choose My Submissions Only. So that's going to show only the documents that you personally have submitted. The other fields are going to include the confirmation number, which you receive on that successful submission notification. You can narrow it by who submitted the request or the submission date, the UTIN if you do have that, or the patient's Medicare number. And then there's drop-down boxes for the MPI, the type of prior authorization, and the status. Now under the actions column, you can see a little icon that looks like an eye, and that's going to allow you to view the actual requests. So if you click on that eye icon, the decision will be open and you can view the current record or the record history. In the upper right corner, there's options to print the decision, return to the previous page, begin a new search, or click Done to return to your home page. Here is a look at a request that has been affirmed. So you see the green circle with the check marks. It kind of calls your attention to the status and the decision. It also has the confirmation number, UTIN, MPI, the request type, and then if it was submitted as an expedited request. Here's an example of a request that has received a non-affirmed decision. So you can see there's a little red circle with an X that draws your attention to that decision. Up in the right, you're going to see options, or I'm sorry, over to the right, you're going to see options to review the decision letter. Now, another option that's available when you receive a non-affirmed decision is to resubmit the request. I've got the option outlined in red on this slide so you can see which one I'm talking about. This is only going to be available on non-affirmed decisions, so you're not going to see it if the request was approved or if it was declined. This button is going to allow you to provide additional information. So clicking on this button is going to open the prior authorization request form. It's going to be pre-populated with the details from the previous request. And then you're going to be able to correct any information that needs to be changed, and you can attach any additional documentation. Then after reviewing your updates, then you can go ahead and you can click Submit. Now, if there's no errors, you're going to receive a successful submitted notification with a confirmation number. Now, here is an example of a rejected request. So again, you're going to get that red circle with an X in it on the decision field that tells you that it was rejected. You will notice that on this request, there is no option to resubmit. Now, if your request is rejected, you can scroll down to the bottom of the form, and in the documentation section, you're going to find a rejection letter. The letter that you see here on the left is from our test environment, so it doesn't apply to a real situation. The letter does notify you that a new prior authorization request can be submitted, and it's going to provide you with what information needs to be corrected or included. Over to the right, you'll just see that's kind of what it looks like when you're looking at the form. You just scroll down and then under documentation, it will have that link for the letter. Now, the last topic that I want to cover today is prior authorization exemptions. CMS does have the authority to exempt a provider from the prior authorization process if the provider demonstrates compliance with the Medicare coverage, coding, and payment requirements. CMS also has the authority to withdraw such an exemption. WPS will notify a provider by letter if they are exempt from the prior authorization process or if their exemption is withdrawn. Prior authorization exceptions is down the second option here under the transactions. So when you select that button, you do have the option where you can view exemption letters or you can view the withdrawn from exemption letters. You don't have to narrow the search down, but that is an option. So here's what your screen is going to look like without any filters. You will see the letter type along with the PTAN and the MPI, the date the letter was issued, and the provider region. Then under the actions column, you're going to have that icon that's going to allow you to review the letter. Exemption letters would be issued when the provider submits at least 10 requests and achieves a 90% affirmation threshold. Withdrawal from exemption letters would be sent when CMS has removed the provider from the exemption and prior authorization request will need to be submitted again. A notice of exemption or withdrawal from exemptions will be provided at least 60 days prior to the effective date. So you will have some warning in there. Now, since this was a test environment, if I clicked on the icon in actions, I wasn't able to see any letters. So unfortunately, I don't have any examples of that, but I did want you to see where you can search for those letters. Now, I believed I covered all the pre-submitted questions in the presentation, so I am going to ask Aline if we've had any questions come through in the chat.
Hi, Karen. I have not seen any questions come in. I'm going to scroll right. No questions at this time.
Okay, thank you so much for checking. Now, when you disconnect from the webinar, you are going to be redirected to a CMS survey. I'm also having add a link in the chat, and I really do hope that you'll take a moment to provide feedback on how I did today. If you're watching this video as an encore, the link can be found in the description of the video. The redirect is going to look like what you see here on the right. We don't have any control over how this appears, so we want you to know that it isn't spam, it's nothing malicious. In our encore videos, the survey link is going to appear like the bottom picture that's titled Online Surveys. Now, the feedback that we received does lead to changes. Chapters have been added to our encore presentations in YouTube. These timestamps can be found in the description and not only give you an overview of what's being covered, but it allows you to jump to the points of the video that interest you most. Training indicators were recently added to the description of our webinars to help you decide if the material applies to you. Although you can usually tell from the title, the training indicators can provide additional details such as whether it's related to FIS or MCS, for example. We've also held 2 Medicare Education Expos based on suggestions for future education topics. We have a third one that's coming later this month, so you can check that out on our live events page and register for any of the webinars that would interest you. So you really can see that your opinion does matter to us, and we do try to put changes in place. Now, after disconnecting today, you should receive a thank you for attending email, and that's going to contain contact hours that can be submitted for continuing education units. If you joined only by phone, WebEx is not able to generate this email, so you will need to contact us. In the chat, Aline will add a link to the education mailbox and what information is needed for us to send you a certificate. If you do think of any questions, those can be emailed for up to 7 days following the event. So if you don't have any now, that's okay. But if something does come up and you want to ask a question about it, please feel free to email us and let us know. That brings us to the end of today's presentation. On behalf of myself, Aline, Mary Sue, and the Provider Outreach and Education team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.